Thank you, Madam Speaker. My question is for the government representative. In recognition of World AIDS Day, we wear a red ribbon as a symbol of courage and hope. It reminds us that the story of HIV is not only written in science, but in the lives and losses of millions. It is a story shaped by courage, inequity, and the unrelenting work of those who refuse to let compassion fade and our hope die. HIV remains a significant public health challenge in Canada and around the world. Prevention gaps persist. Comprehensive sexual health education is not consistently available, and millions rely on global efforts, particularly the Global Fund for Access to Life-Saving Prevention and Treatment. Senator Moreau, through you, I ask the government, what concrete steps is Canada taking this World AIDS Day to strengthen its response to this issue, specifically by increasing investments in HIV prevention, supporting comprehensive sexual health, and ensuring Canada continues to be a strong, reliable contributor to the Global Fund's work to end AIDS globally?
The short answer to your question is that the Government of Canada will continue to work with communities, health care providers, health authorities, and organizations to put an end to HIV as a public health concern. I thank you, Senator, for highlighting World AIDS Day. I will note that after several years of increases in Canada, we have seen a small decline in the national rate of new HIV diagnosis in 2024 compared to 2023. However, the government knows HIV remains a concern in Canada. That is why the government renewed action plan on sexually transmitted and blood-borne infection recognizes that STBBI do not affect all people equally, and outline a response that addresses to overlapping social and structural factors that shape health outcomes.
Senator Wells, Alberta.
Thank you, Senator Moreau. I'm concerned that some provincial governments continue to restrict access to comprehensive sexual health education in schools, and others refuse to release timely information about alarming rates of HIV and STBBI infections. Prevention and education are critical in this work. Can the government specify when we can expect updated funding allocations for prevention and education through the Public Health Agency of Canada? And will Canada restore its contribution level to the Global Fund?
Well, there's already a strong pledge of $1.02 billion reflects Canada's continued resolve to support coordinated global effort to tackle major health challenges while staying in line with our historical levels of support and recover from the investment surge for the COVID-19 pandemic. The Global Fund is highly effective financing mechanism that delivers for the poorest and most marginalized, whistling strengthening global and Canadian health security.